Hello and welcome. My name is Dr. Veselina Kalancheva. I work as a clinical fellow with the Department of Psychiatry at Children's Health Ireland at Crumlin, or formerly known as Our Lady's Children's Hospital. I work alongside Professor McNicholas, who is a consultant child and adolescent psychiatrist. This presentation is focusing on anxiety and some basic anxiety management skills. I just need to take a moment to start sharing my screen before I continue. To begin with, well, look at the core emotions. Experiencing a wide range of emotions is natural and part of being a human. Babies are born with the ability to feel basic emotions, and based on their temperament, the emotional response will be more heated or subdued. The level of emotional reactivity varies from an individual to individual, and it's closely connected to the inbuilt personality traits and genetic makeup. Emotions aren't good or bad. They are a way to respond and connect with the surrounding environment. However, when an emotion becomes prevalent, persistent, and difficult to manage, then it affects normal functioning and causes distress. Let's have a closer look at fear or anxiety, which is the topic of this presentation. Fear is a natural response to threat. It triggers a cascade of events in the body, which results in increased heart rate and breathing, tension in the muscles, dilation of the pupils, and so on, in order to prepare the body for a fight or flight. Experiencing a certain level of anxiety isn't always bad. It is actually helpful. Otherwise, we wouldn't be able to deal with day-to-day challenges, and a small dose of anxiety actually improves our performance. The potential triggers for an anxiety response changes with age. So there are fears that are age appropriate and do not stick for too long. So this table illustrates some of the most common sources of fear based on the child's age. Anxiety becomes a problem or a disorder as we call it in psychiatry, when it starts causing significant level of distress and affects day-to-day life. So, for example, there are different types of anxiety disorders. Separation anxiety is often seen in the younger age group, and this is a fear of being separated from the primary caregiver. Selective mutism refers to fear of speaking in certain situations, despite the fact that the child is well able to communicate at home or with close friends and relatives, for example. Social anxiety, or fear of social situations, is this is the condition when the individual might feel observed or judged by others, and then avoid such situations. This is most commonly seen in adolescents or young adults. We talk about generalized anxiety disorder when there is a persistent, unexplained worry and expectation that something bad is about to happen. A specific phobia is experiencing an intense fear of spiders, for example, or heights, and so on. In panic disorder, the individual experiences bouts of overwhelming fear without any specific reason. However, when someone is in a state of panic, the threat feels so real that the person genuinely believes that they are about to die. So, in other words, the anxiety becomes a newness when there is inaccurate appraisal of a potential threat, with excessive worrying in various circumstances coupled with physical sensations. Anxiety disorders are diagnosed in approximately 30 to 40% of the people with 22q deletion syndrome across all age groups. The frequency of the diagnosis is higher in children and adolescents, and usually more common in females. In comparison to the general population, the prevalence of anxiety there is around 20 to 25% based on different population studies. Anxiety disorders overall are very common in general, but the 22q population is at higher risk of developing an anxiety disorder of different type, most likely as a result of the combined effect of biological factors, the genetic defect itself, in addition to learning difficulties, speech and language difficulties, or social communication difficulties that are often part of the clinical presentation of the syndrome. Children often find it hard to verbalize their feelings, and instead they can display or complain from a number of physical symptoms, such as poor appetite and sleep. They might experience stomach pain or headache. They might have difficulties breathing. There might be change in their behavior. They might be more angry or irritable, clingy, overactive, and not able to focus. There is an urge to avoid the anxiety-provoking situation or engage in various behaviors to alleviate the anxiety. But no matter what type of an anxiety disorder we're dealing with, all of them can be described with the cycle shown on the picture. There is the anxiety-provoking situation or potential threat that alerts the mind. It sets the alarm off. The overwhelming emotion provokes bodily sensations and increasing fear that the person would not be able to cope and is in danger. And instinctively, the first reaction is to avoid the potential threat, which shortly reduces the anxiety, but brings more insecurity and worry on the long term. So anxiety work is about breaking the cycle. The first step in almost any psychotherapeutic approach for anxiety management is to learn how to control breathing and master muscle relaxation. And as trivial as it sounds, but there is a very good reason for this. Our breathing becomes more frequent and shallow when we're scared. This is called hyperventilation. When we hyperventilate, the level of oxygen in our blood rises and the level of carbon dioxide drops. If you do a little experiment and start hyperventilating for even a minute, you will feel lightheaded, dizzy, and you might have the sensation of pins and needles in your hands, or even experience chest pain. This is very similar to the symptoms experienced by someone who has a panic attack. If the person manages to take control of their breathing, the heart rate will slow down, and they will be in a better position to control the unpleasant physical symptoms of anxiety. Similar with muscle relaxation. In a fearful fight or flight situation, the muscles get tense, the whole body stiffens as a direct response to the adrenaline rush. Relaxation exercises will prevent this false threat response to develop further. And practicing breathing and relaxation is the first step to manage anxiety. It could be actually a very fun activity to do with your child. It takes time to master the skills, but it's well worth it. There are many videos online showing breathing exercises and muscle relaxation. I have listed a couple of websites towards the end of the presentation. Moving forward with the anxiety management at home, you can help your child start naming their emotions and putting words to the feelings. A lot of the time, anxiety is about inaccurate appraisal of a threat. So help your child to think about what is really true instead of what might happen. Talk about what can be done if something little bad happens. Challenge the unhelpful thoughts with realistic thoughts. Set time to talk about the worries without being interrupted. You can call it worry time or whatever name you come up with. So there is only one rule: no thinking or talking about worries outside worry time. If a worry creeps up, encourage your child to store the worry in a worry box. They can write down a little piece of paper and put it in a jar or a separate box that they have for this purpose, because talking about worries over and over again and asking the same questions makes the worries grow. Always, when you're setting up worry time, always begin and finish with breathing exercises and relaxation to allow your child's anxiety to level down. Anxiety triggers cannot be removed from day-to-day life. Unfortunately, anxiety is not possible to be eliminated. It is about really building confidence and resilience by challenging the fear-provoking situations alongside your child. Start with something that feels a bit easier to handle and work towards more challenging tasks. This is what we call gradual exposure. So, for example, if your child is afraid to go to a birthday party, start by smaller events. Start by birthdays that are within the family, and then gradually build it up by saying, okay, you can go to why don't you try going to the party just for half an hour, and then I'll come and pick you up, and then increase the time going forward. So don't forget the importance of the very basics, such as good nutrition and sleep. It might be helpful to create a suiting box where the child or the young person would have easy access to objects that they find suiting. For example, things that are appealing to their senses, squishy toys, art and craft materials, or pictures of favorite people or places. All this could be stored handy in a box and be used as needed. Distraction is really helpful for anxiety. So use things like playing games, singing, dancing, baking. All these activities could help your child to wind down and regulate their emotions. At times, the difficulties could be more complex and would not respond to basic anxiety management. Then your GP may need to refer the young person or the child for a specialized psychological intervention. This could be done through primary care or other support organizations that provide workshops for parents and children for anxiety, such as Bernardo's or ISPCC. A referral to a specialist child and adolescent mental health service could also be needed for more complex presentations where the young person could receive a specialized treatment. I would like to make one more point before I finish. Anxiety often runs in families. It is likely that other family members could be affected. And if you, as a parent, experience anxiety, be aware of your own triggers and responses, because children are very observant and often copy parents in their behavior. So be open and honest with your child about your own difficulties and look for help and support. These are some books that you may find helpful, and these are a couple of websites that have a lot of resources for anxiety and breathing and muscle relaxation. The Mindful Gnats is more tailored towards younger children. The Anxiety Canada website is more suitable for adolescents and young adults. I would like to thank you for listening. If you would like to leave a feedback, it would be it will be highly appreciated. Thank you. Thank you very much.